Hey guys, how's everybody doing today? This is Dr. Gilead Show. We are transmitted on Facebook Live and on WBGR Radio. Today we'll be talking about dissociative identity disorder, DID, dissociative identity disorder. Today is Thursday, February 16, 2017. You are on Dr. Gilead Show. I'm your host, Dr. Theo Oswala, MD. I'm a psychiatrist. Today, we're going to be talking about dissociative identity disorder. I'd like to, as usual, let everyone know that on this platform, you cannot make a diagnosis based on what you hear. And please do not treat someone based on what you hear on this platform. It's always good to consult your doctors or trained personnel so that you can get the appropriate diagnosis, the appropriate treatment. Dr. Gilead Show, the producers and the guests will not be held responsible for what anyone does based on what they hear on this platform. All right, so today, dissociative identity disorder. You can reach us on Facebook Live, Dr. Theo, one word, Oswala MD, one word. And you can also call us on WBGR Radio, and the phone number to call is 301-429-9247, 301-429-9247, WBGR Radio. All right, thank you. Dissociative identity disorder. This, for many of us who probably have some idea of what it is, it used to be called multiple personality disorder. Multiple personality disorder. This actually is a complex psychological condition. It is a condition in which you have severe dissociation that produces a lack of connection in the person's thoughts, memories, feelings, actions, or sense of identity. So you have someone who dissociates, separates themselves from who they really are. And this happens both in their thoughts, in their memories, in how much they can remember or cannot remember, their feelings, their actions, or a sense of who they are. Now, the defining features of this disease is the presence of two or more distinct personalities. So you have a person who suddenly has two or more persons or feelings or states of the personality or an experience, or what sometimes people may call possession. So they have a distinct personality state and or an experience of possession, like something takes them over. And in some religions, they may look at this differently. So most people may experience mild dissociation, which comes like daydreaming, or like you are doing something, you get lost in the moment while working on some task. So this is not unusual. It could happen to some people, but that is not what we're talking about here. So we're talking about a situation where someone may completely lose their identity. They change completely to someone else, and they feel like they are someone else completely. They think that they are someone else completely. So this is a completely different person, who is here reacting differently to his or her environment. That is multiple personality disorder. Someone may ask, is dissociative identity disorder real? Is it real, or is it just a fluke, or is it just something that everybody thinks about. So, but the thing is, multiple personality disorder or dissociative identity disorder is a difficult diagnosis to make, even with for the highly trained experts. It is difficult. It's a little hard to make that diagnosis. But the Diagnostic and Statistical Manual of Mental Illnesses, 5th edition, which is the book, the Bible of psychiatry that we use to make diagnosis, recognizes it, and it's accepted as a major psychiatric diagnosis. So it must be real then, because with that book, before that book is written, a lot of research is done, and with the most recent edition, the 5th edition that just came out, is more all-encompassing. It's more, it covers a lot. So, and DSM-5 identifies dissociative identity disorder as a major psychiatric diagnosis. So it must be real somewhat, even though it's difficult to diagnose. All right, we're going to look at the causes. I see, hey Chuck from Baltimore, thank you for joining. And Dwight, thank you for joining. So we're talking about dissociative identity disorder, DID, or multiple personality disorder. You can call on WBGR Radio, 301-429-9247, 301-429-9247. What are the causes, or what could be the causes of DID? Now, dissociative identity disorder is associated with a combination of factors that may include childhood traumas, children that are traumatized, or people that were traumatized as kids. They end up coming up with things like this. Childhood traumas like physical abuse, sexual abuse, sexual molestation. Even of importance also is even childhood medical and surgical procedures. It's been shown that even some procedures, medical or surgical, that people go through as children end up causing some trauma when as they grow older. Now, we have wars and fighting all over the world. It's also been shown that traumatic experiences in war situations also affect young people as they grow older. We have wars all over the world, across the globe. Yesterday, the president was talking about the war, the problem across the globe, in Middle East, in Europe, in Africa, across the globe. We have problems everywhere. And a lot of people, a lot of young people, children, are caught up in these areas, in Syria, in Iraq, in Afghanistan. A lot of trauma. And this has been shown to predispose, in some people, dissociative identity disorder. Also strongly identified was a childhood prostitution. We know about that. A lot of that is going on. And terrorism has also been reported to be one of the predictors or one of the precipitators of dissociative identity disorder. So this is a diagnosis that probably we're going to be seeing more and more as the world goes through these very traumatic times. So healthcare providers should really be ready to manage this very difficult illness to diagnose. So we will all look out for them as childhood traumas increase, and especially in these war-torn countries, and as the economy continues to be hard, We're going to have more problems with young people, more traumas, and so we hope that people will look out for them. All right, now it's known that the dissociative aspect is thought to be a coping mechanism. So the dissociative aspect of this disease is a coping mechanism. So in this kind of, in this person, they try to dissociate themselves from situations or experience that is too violent, traumatizing, or painful to assimilate with the conscious self. So these they remember these situations or these traumatizing events, and it's so hard for the person to manage it, to assimilate it. So what happens is they try to block it. So they try to find a way to cope with it, and that comes up as some dissociative identity disorder. It becomes a big disorder. Now, what is the prevalence of DID? There was a study done, a 12-month study done in a community in the U.S., and it was found that 1.5% of people had DID, some amount of dissociative identity disorder. But the overall prevalence is about 0.1 to 1%. But in that community, it was found that 1.4% of those who had it were females, 1.5 were males, 1.6 were males. So you can see that is even though it's not very common, but it's not as uncommon as we probably think. So so let's look at what are the symptoms. What are the symptoms of dissociative identity disorder? What are the symptoms? Here, one of the symptoms is you must have the presence of two or more distinct or split identities. You have two or more distinct or split identities of the person, or kind of personality states that continually have power over the person's behavior. So you have a person who suddenly develops two or more distinct split identities or personality states that continually take over the person, takes over the person's behavior, and you see that they are completely a different person altogether. Now, during this time, the new person is completely different from the real person. Also, the individual is unable to recall key personal information. And this difficulty with recall is too far-reaching to be called simple memory problems or simple forgetfulness. There are people who forget things. I've seen people, they come to my clinic and I say, how old are you? And they have to stop to think how old they are. Or some people, you ask some people, what year did you get married? Oh, many years ago. But they struggle to tell you exactly what year they got married. But they get themselves together and they are able to recall when they got married. So what I'm talking about is completely different from simple forgetfulness. It's more than that. They have difficulty recalling key personal information. And for things like you forget your name or your birthday, that is far-reaching. So it's completely different from ordinary being forgetful of some vital information. Number 3 symptom is there are memory variations with the different personalities, and that is when one personality is doing something, the other person or the real person does not remember what the other person is doing. Now, and this is called dissociative amnesia, dissociative forgetfulness. There can be three ways this could happen. This could be, they could have gaps, some little gaps in memory, in remote memory of personal life events. For example, when say John is a man and he dissociates into Matthew or into another person, he completely forgets his childhood or some things that happened in his adolescence. They completely forget some life events. They can even forget the death of grandparents, or someone who is married will completely forget that he was married. So these are events that you would expect any normal person to remember, but they completely forget. They don't remember anything about that because this is completely a new person, completely new in. Or he got married some years ago. This new memory of things that happened the same day. Memory, memories of what they've learned, the job that you do. Can you imagine that having gone through med school and done management and come out, somebody talks about it. I'm a new person. I become completely a new person and cannot remember my medications, all the things I treat people for. New person completely. A dependable memory of what they've learned. That is number two of how some of the memory problems could present. Number three is they could have. Right, guys, welcome. Welcome back to Dr. Gilead Show on Facebook Live and on WBGR Radio. We are transmitting on Facebook Live, WBGR Radio, and you can call on 301-429-9247, 301-429-9247. We're talking about dissociative identity disorder, DID, or multiple personality disorder. Okay, also, so we're talking about the symptoms of dissociative identity disorder. Now, we talked about the memory issues. Now, the other problems that they could be imaginary people sometimes. They could also be or dissociate to like animals. This is now they also have what we call switching. This is when each personality reveals itself and controls the individual's behavior. So they have these personalities that take you over. So they switch from one person to another or to an animal, or a male could switch to a female. It's quite amazing how these things happen. And the switching could be in seconds or in minutes or in days. So they could in 1 minute be a male, and in another minute act like they are a female. Some days they could go days as one person, and in another day they go as someone else. So DID is a very complicated mental health disease, but is with us. It's one of the things that people have. Now, it's also known that the personalities that take over the individual are recurrent. That is, it happens all the time, and they are unwanted by these individuals. So it's not something that the individual really likes, and actually they cause a lot of clinically significant distress, and they cause a lot of impairment on the individual. So it's a tough illness. It's tough to deal with on the individual, and of course on the family as well. So it's a very tough illness. People have gone, they try to do everything they can to get better, but it's tough. Now, in some situations, it appears like a spirit, in quote, takes them over, and they begin to act like supernatural beings. There have been situations where they act like an outside person has taken control of their life, and they act in a different, distinct manner. Individuals have been shown to be replaced with a ghost of a dead person. For example, there was a situation where a young girl had passed a few years prior in this community, and this other individual, when she dissociates, she acts like she's been taken over by the spirit of the dead girl. That girl committed suicide in the same community. So this individual that has dissociative identity disorder, every time she dissociates, she begins to act like the girl that committed suicide. She talks about herself as a girl. She talks about what happened and what did not happen. And so that is why in some communities and in some religious organizations, they sometimes look at it from a spiritual point of view, which may or may not be. But that's not what we're talking about today. It's just that some people, when they dissociate, they act like they've been taken over by the spirit or by the person, or they carry the personality of the person that had died prior to that. Some have had self-persecution, and that is they hate themselves, they persecute themselves. Some have even hurt themselves. Some act like a part of their body is not part of them. So they cut their arm, or they do things to their bodies. Now, some people, when they dissociate, they act in a different character. They have activities that are completely out of character for them. For example, you could see a perfect gentleman or a lady who normally is calm, level-headed, but when she dissociates into something else or somebody else or some other personality, they drive erratically. They drive so fast. And people have stolen from the stores, or even stolen from their bosses or very close friends, for not something they need, for something that they have really no need for, and they steal and they put it in their purses or in their handbags, and when you ask them, they have a feeling of being compelled to do it. It is completely out of character for them. They don't do such things. When you ask them, they describe themselves as if they've been taken over by some other powers. And some have described it like they are passengers in their own body rather than the drivers. So they know or they feel that they are completely not in control of what they're doing. We would always want to do what we want to do. We want to do what is right. We want to do what is appropriate for the specific time. So, but these people, when they switch their personalities, they do something completely out of character for them. You can imagine a good reverend gentleman changing to a completely different man, grabbing some beautiful girl on the road or in church, when he is supposed to be the preacher. He is supposed to be the good, godly reverend man who is the representative of God in the congregation. So it becomes a completely embarrassing situation. And they don't know, they are completely unaware of what they're doing. And the other part of it is they do not remember what they did during these episodes of dissociation. We had a girl in the unit when I used to work in the hospital. When she dissociates, anybody, it does not matter who you are, the doctor, the nurses, she doesn't know you, she doesn't remember you, she could hit you. It would take as many as 10 strong-bodied security men to hold her down. And after the episode is over, she does not remember what happened. Sometimes in course of her dissociation, she gets hurt, she gets injuries, but does not remember completely how those things happened to her. So this is one of the ways that dissociative identity disorder presents, and is very traumatizing to the individual. It's not anything that anyone will want to have. It's tough on the individual, and if they had their way, they will not let that happen. But it's what it is at that time. All right. Now, there are other associated mental health issues that could be part of this. And you can imagine someone who is a man begins to act out of character, talk like a female, and or even bark like a dog, and will crawl on his knees like a four-legged animal. Then he realizes that all people, and these days when people have their phones, they could record it and show him after. That could be so embarrassing. Depression is one of the symptoms or one of the co-occurring mental health issues or psychological illnesses that could occur with dissociative identity disorder. So sometimes they become so depressed, and this clinicians, doctors will have to deal with, because they need some help. They will need some help treating their depression. So it's something that the providers have to deal with. Now, people who also have dissociative identity disorder have some amount of mood swings that could happen in bipolar disorder. They have situations where they feel they have their mood going up and down, and that is also understandable. Someone with dissociative identity disorder, when they are not dissociating, when they are their normal self, could be calm, sitting down, not saying anything, and they have a situation where you see them having a problem dealing with other people. So their mood swings up and down. There's a question that came here. It says, can psychotherapy help this condition? This is from Ms. Gloria. I will get to the treatment. If you be patient with me for 1 minute, we'll get to the treatment of it. It's a very difficult condition to treat. Very, very difficult. But Ms. Gloria, if you give me a minute, we'll get to the treatment of it. But let's finish treating the the symptoms that could co-occur with dissociative identity disorder. Now, they have suicidal tendencies, and it could be understandable. When your mood is swinging, you're depressed, you move from acting like a normal human being, acting like an animal, or doing things out of character for you. You can imagine someone who, perfect lady, married, and dissociates and begins to talk about how she will want to have sex with somebody, or how she maybe had sex with an animal, or wants to have sex with a dog or something. So these kind of things could be embarrassing, and when they look at it or they remember or somebody tells them what they did, they could become suicidal. They don't want to people to look at them differently, when as a matter of fact they are not that way. It's just a part of the illness. So they become a lot suicidal when they go through these situations. Other things, they could have sleep disturbances, sleep disorders. People with DID have nightmares, a lot of traumatic dreams. They have sleepwalking, and in sleepwalking, people could get up, and because they are still in REM sleep, but they are walking, they get hurt, they could get injured, and sometimes they could drive cars and get into motor vehicle accidents, terrible, terrible accidents that could be fatal. People with DID also could have severe anxiety disorders, panic attacks, which we talked on this platform. It is a very traumatizing experience. They have anxiety, their heart is beating so fast, they feel like there's a lump in their throat, sweating, butterfly in their stomach. Sometimes they throw up, lightheaded. And I have had patients of mine with severe anxiety disorder fall down and pass out because the heart is beating so fast, it's not pumping enough blood to the brain, because the rate at which it's beating is not strong enough to send enough blood to the brain. They fall down, they pass out. And once they hit the ground, more blood flows to the brain and they wake up. So people with DID can have severe anxiety attacks and panic attacks. Other things they could have, just to help themselves self-medicate, they go into a lot of drug abuse, substance abuse. And that kind of, what that does is it blocks their feelings. It drowns these traumatizing, distressing feeling. They drink a lot of alcohol. Sometimes they do opiates, heroin. They also may do cocaine and phencyclidine, so PCP. They do all kinds of drugs to block their feelings, to block this traumatizing experience. Sometimes they could have clear psychotic symptoms, psychotic illnesses, things like hallucinations, especially visual hallucinations and auditory hallucinations. They may hear voices or see things that are not there, which is clear psychopathology. Sometimes they have eating disorders. They binge eat, like we discussed on this platform. If you remember, we talked about eating disorders with Dr. Angela Owanabe a long time ago. So they have all types of psychopathologies, psychiatric illnesses. So if people with dissociative identity disorder have a lot of difficulty. It's very, very traumatizing. Excuse me. All right, thank you, Mr. Clark. I see Mr. Clark joined from Washington, D.C. Thank you for joining. All right, so let's look at the treatment of dissociative identity disorder, the treatment. Gloria, you may take note of this. But anyway, guys, on this platform, we're talking on dissociative identity disorder, if you just joined. And DID is not such an uncommon illness. It occurs in a lot of our society. We are on WBGR radio today. You can call on 301-429 8950 301-429-9247. 301-429-9247. That is on WBGR radio. You can also send us questions. As one of the questions came in is, can psychotherapy help this condition? To answer that question, I want to say it this way. There is no known cure for dissociative identity disorder. There is no, every research has been done. Up until now, we do not have any treatment that can help people with multiple personality disorder. It is a very difficult treatment. It's a very difficult illness, rather. The main treatment is psychotherapy. So, Gloria, the main treatment is psychotherapy. And it has been known that the type of psychotherapy that has shown some amount of help to people is dialectical behavioral therapy. This is a subspecialized type of cognitive behavioral therapy. In this therapy, psychologists and the therapists will give the patient a workbook, and they write down their experiences, both in the real personality and in the different personalities as much as they can remember. And the question is, how do they know when their personality is about to switch? Is there a thing they can do to prevent that switch? So, cognitive behavioral therapy, dialectical behavioral therapy is used to manage this illness. But it is one of the most difficult psychiatric illnesses to be treated. It's difficult. It's difficult on the patient. It's difficult on the therapist. It takes a long time. It takes quite a long time. Sometimes the person will continue to have their switches, switching from one personality to another, but psychotherapy may reduce the amount or the frequency of the dissociation. And if the co-occurring psychiatric illnesses are properly treated, and the trauma that they went through, whether it's childhood traumas or terrorism traumas, or trauma from medical or surgical procedures when they were young, or even traumas in areas of conflict, wars, like we have wars all over the place now. Once the people are treated of these traumatic symptoms, the nightmares reduce, and they become more in tune with normalcy. The tendency to switch, the tendency for the psychopathology of dissociation begins to decrease. But it is hard. It is a difficult psychopathology to treat. Sometimes hypnotherapy has been applied. Hypnotherapy has been applied, and people got some help from it. But overall, it is hard. It's a very difficult treatment. It's a very difficult illness to treat. Other treatment modalities are like art therapy. So they get involved in some artwork, some music therapy. Different therapies have been tried, but you can see from the different types of therapies that there is no hard and fast rule on how to treat this, because it is a difficult illness. A lot of struggle. People have tried different things, and results are still not very clear. Now, there are no known clear medication that can be used to treat this illness. Medications have not helped, but what medications are used for mostly is to treat the co-occurring illness, the co-occurring psychopathology. That is what the medications have been used for. For example, if someone has depression, the depression is treated with antidepressants, and that could help manage their feelings, their depressive symptoms, and if that is taken care of, it removes a lot of stress from them, and they feel a little better. For those who have co-occurring anxiety disorder, anti-anxiety medications are given. That is also helpful. Once the anxiety is managed, the panic attacks are managed, they calm down a little bit, the tendency for their personality to switch tends to decrease a little bit, but overall, there is no clear medication, psychopharmacology that can help these people. That it's also been known that people who use stimulants, cocaine, phencyclidine, which is PCP, ecstasy, once they quit doing these drugs, once they kick the habit, it's been shown that sometimes, somehow, they get a little better, and they feel somewhat better. The amount of switches will decrease. But overall, there is no clear medication treatment for this. The only thing that has worked is psychotherapy, which is a type of cognitive behavioral therapy, which is called dialectical behavioral therapy. That is also used for borderline personality disorder. So some of these things, some of these other psychopathologies cut across with dissociative identity disorder. Now, how does this illness affect the individual? Because the essence of Dr. Gilead's show is to educate people so that people can learn how to manage themselves, also have families can help individuals who have these psychopathologies, psychiatric illnesses, or mental illness, or psychological illnesses, whichever term you want to use, how families can identify it and get some help for them. Now, the individual who has dissociative identity disorder, you can imagine how stressful this will be on the individual. Now, they wake up in the morning, they have a job, you get to your job, instead of sitting down to do your job, you change, your personality changes, and you lose memory of how to do your work. You are an IT expert, you don't know how to operate the computer anymore. Or you are a teacher, you lose your memory of everything you've learned in college on how to teach students. Or you are a teacher in front of students and you switch and begin to bark like an animal. It is frustrating. And such people, what happens is they cannot keep a job. So what happens is the individual loses the job, and they don't have any income anymore because they can dissociate at any point in time. So they don't have a job, they have no income, they avoid social gatherings because nobody wants to get the embarrassment of dissociating in presence of people. And when they have a stressful situation, sometimes they have panic attacks in the midst of a lot of people in crowded places, they can dissociate. So what happens? Nobody wants to associate with them because they can dissociate. Nobody wants to associate, they don't have friends. You can imagine going out on a date with a guy, and while you're in a restaurant eating, and he dissociates and begins to talk like a female, or begins to act in a way that is completely out of character for him, or her, as the case may be. So it's such an embarrassing situation. So nobody wants to hang with them. That is very frustrating. And you can see why a lot of them will take part in suicidal activities, because nobody wants to deal with them. Now, how does this illness affect the family? A situation where you have a child, your son, your daughter, who cannot go to school, or even if they go to school, they can't get a job, they can't relate with the family. You go out on family gatherings and they are dissociating. At the end of the day, there is so much conflict in the family. You can't hang out with your parents or with your children because you cannot predict what will happen when you are in the public with them. So it's a very frustrating situation for the family, and it brings a lot of conflict in the family. Or maybe your spouse or your husband or your wife or your partner, you can't predict what they will do when you are outside. It's a very frustrating illness. Now, for the society, it costs a lot of money to treat someone with DID. It costs a lot of money, insurance money, Medicaid, Medicare money, and also because they are not productive in the society, what happens? The society has to take care of them. So it generally affects every facade, every aspect of our society. So what do we do when we have such a situation? The individual should not be ashamed, should be able to volunteer the information, go get help, and get some therapy. There are some psychotherapists or therapists that are specialized in treating DID, multiple personality disorder. Search online, ask your doctors to refer you for the doctors or the therapists that are specially trained to manage people with dissociative identity disorder. It is, help can come. It's a very difficult illness to treat, but go get some help. Families should encourage their family members to go see somebody, and families should support them. Once they are dissociating, try and keep them in a safe place. Avoid, do the best you can to prevent them from driving so that they don't get into accidents, or when they do things out of character for them, try to show some understanding, try to do some restraints, help them out. And if you are unfortunate that your spouse, when he or she dissociates, does things out of character, well, you really will have to give this person support. Leaving the person, breaking up in the marriage, will worsen their situation. But once they have a good support, they feel somewhat better. They feel someone really cares. And they will have less dissociations. But if they feel abandoned, they feel left alone, their illness will be worse. They're more depressed. They have more anxiety attacks, and once they have more anxiety attacks, they dissociate more and more. It becomes a bigger problem. It becomes a revolving door. So we need every support, and refer them, help them find a provider who can really be of assistance to them. And sometimes they may need a family member to drive them to their appointments. And also, from the family point of view, do the best you can to avoid things that could predispose our children from traumas that could finally predispose them to dissociative identity disorder when they are much older. So we should avoid physical trauma, we should avoid sexual trauma, and in these times when we are in war situations all over the world, we should do the best we can to protect our children. And I'm beginning to get worried about the things we see on TV. Sometimes people are beheaded. These are all traumatizing situations to our young ones that could predispose to someday dissociative identity disorder. Today we talked about dissociative identity disorder, multiple personality disorder. I know that you've learned about it. You can also check this out on Facebook Live on our page. Also on YouTube, if you go on Dr. Gilead Show, put in Dr. Gilead Show, Dissociative Identity Disorder, you will find it and you can rewatch this. We are always on here every Thursday at 1 p.m. on Dr. Gilead Show. Thank you for tuning in. Today, I'm Dr. Theo Oswala, MD, your host. Thank you very much for tuning in. We'll see you again next week, Thursday at 1 p.m. Thank you very much.